Hello, sir. Good morning.
Good morning, sir.
My name is Dr. Sahan of the PACES candidate here today. I've been asked to examine your chest. So, sir, what I'm going to do, I'd like to have a very good look first, feel, and then tapping and listen to your chest. So, do you have any pain at your chest right at this moment?
No, sir.
All right. So, during this procedure, if you have the pain and discomfort, just let me know. I'll stop at that moment. Is it all right? Yes.
Yes, sir.
All right. So yes, the doctor immediately entered the room, the respiratory station. The jeep bundle packs, my dear, you need to do. There is a greetings, introduction, instruction, pain, position, and posture. And after the position, you see the 45-degree angle is adequate enough. And now the posture, you need to do the expose this man to examine his chest. So, sir, would you mind just to put a few count? Is that all right? So, yes, sit forward. So, immediately after the exposure that you can see onto the back, yes, there is a left-sided thoracotomy scar. Yes. And you need to start your examination for the foot and like the symmetry and the approaches, my dear. The approaches are, we learned that the symmetry, epidiameter, and the crackles, and then asymmetry, scar, and the trachea, and the asymmetry with no scar with the dull and percussion. So now we are the asymmetry with the scar and the trachea. So let's start with the examinations, my dear, for the foot and bed. For the foot and bed that we are looking for, and you need to tell him, sir, could you please turn your head on the left side? Left side. Yes. And take a deep breath in and out for me. Once again. So what I'm looking for, I can see that the right chest moves, not that much the left chest. I can see at the bedside, there is a sputum port. You can see the sputum port here. So this sputum port is nothing but the diagnostic for the bronchiectasis. So see the sputum port at the bedside is a diagnostic for the bronchiectasis. So yes, my dear doctor, approaches say that if you found the asymmetry, so I found the asymmetry, the left chest moves less than the right. Asymmetry. And we found a scar, the thoracotomy scar. So the diagnosis, the pneumonectomy and lobectomy. Now I need to confirm it, whether it's pneumonectomy and lobectomy, just by putting the hands on the trachea. If it is the trachea is shifted, the diagnosis is pneumonectomy. If not that one, that is a lobectomy. So we need to put the hands onto the trachea. But beforehand, just keep in our mind that we need to start the examination for the hands, my dear. Sir, could you please just show me your hands like this? Yes. You lie back. So you need to see the hands. And I can see that he has got clubbing. The fingers are clubbed, but no nicotinic staining, no wash. So yes, I can see the clubbing. The fingers are clubbed. He has got the clubbing, but no nicotinic staining. Turn the hands like this to compare with my own hands. So no pulmonary edema. Yes. No warm hands. And the pulse that you need to count the pulse. There's a bounding pulse, no bounding pulse, but you need to count 15 seconds for the respiratory rate, my dear. What are the methods that you need to do all the things together for each and every cases, my dear? So you need to tell him to cock up your wrist back and spread the fingers, and you need to see any of the carbon dioxide retention findings, the flaps. So the flaps are absent. Now to the face that is simple, that you need to look up for me. So no anemia. Look down for me, look down. Yes, no jaundice. Stick your tongue out for me. No anemia. And up. No jaundice. And for gum hyperplasia, so no gum hyperplasia as well. So yes, my dear, getting down to the neck, that we have found that there is a small scar over the supraclavicular fossa. It's around 2 to 4 centimeter size. The scar is nothing but the phrenic nerve crush. So yes, my dear, you see the phrenic nerve crush. The scar here is nothing but the treatment for the tuberculosis in earliest time. So this is signifying that the old tuberculosis of the phrenic nerve crush. as because we have found the sputum port at the bedside, the bronchiectasis. So definitely the bronchiectasis is caused by the tuberculosis and the phrenic nerve crush, also giving the evidence of the old tuberculosis. So now the chest proper examination, that my dear, you need to examine the CP and BSBR all together, with the chest expansion, percussion note, breath sound, and vocal resonances all together. You need to do that, all them together on the front of the chest. I'm just avoiding here. I will go to the back, just show you the examinations might all together. So my dear doctor, look at the back that you can see, the left-sided thoracotomy scar. If you move forward, you can see a big-sided, left-sided thoracotomy scar. And this scar, you see extended from the back and going down and to the lateral border of the chest. Yes. And you can see the scar, the left-sided thoracotomy scar. So now you need to examine him from the back side, because the scar mark is here. You need to do all the steps, CP and BSBR, all the trachea as well. And we found the trachea shifted, so the diagnosis is the pneumonectomy. And we are expecting pneumonectomy means that all the findings on the left side are absent. So the chest expansion, so you need to do, put your hands, take a deep breath in and out. So you see the left side is not moving. Once again, take a deep breath in and out. Once again. So you see, once again. So you see the left side not moves. Once again. Once again. So yes, the left side not moves. Next to the C, then the PN, by the percussion note, means the lungs are absent, so all the findings will be absent. So you see, this is dull sound here, this is tympanic, and this is dull sound here, and this is tympanic. This dull sound here, this tympanic means the resonant. The dull sound here, the resonant. So yes, the percussion note and the breath sound, once again, are vocal resonances. So what we are expecting, the findings in the breath sound and the vocal resonances are absent on the left side. Can you take a deep breath in and out? Once again, once again, once again, once again, once again. Can you say 99 for me?
Yes, sir.
99?
99.
Once
99.
again.
99.
Once 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 again.
99.
Thank you very much, sir. Immediately after that, you finished your examination of CP and BSVR, that you found that all the findings are absent on the left side, but they're present on the right side. Now you need to put your hands for the anterior chain and the posterior chain and the supraclavian lymph glands that are absent, not palpable, not enlarged. So immediately after the lymph nodes, that you need to see the leg edema. I need to tell him, sir, do you have any pain at your legs? No.
No, sir.
All right. So no leg edema here. I need to give the clothes back here and give the clothes back. So immediately after the face examination, that you need to put the hands to the trachea, because I say the asymmetry scar, then the trachea. Tracheal position is very crucial here. So you put the trachea and yes. And as because you felt that there's a pneumonectomy or lobectomy, in case of pneumonectomy, you can find that the right side of the lung is push the trachea towards the left. So that's why we can get the space onto the right side is more than the left side. You see that I can't move on the left side, but yes, the right side of the trachea is moved to the left. So the right side means the trachea shifted to the left. The diagnosis of the pneumonectomy, in contrast to the lobectomy, where the trachea is not shifted usually. So the diagnosis is done, the pneumonectomy. So yes, my dear doctor, immediately after that you finished your examinations, then what you need to do, you need to wash your hands and say him, just sir, thank you very much. You have done really excellent. So yes, and wash your hands and then come forward to the examiners and say that. So I'd like to finish my respiratory system examination to check and to do the test at the bedside spirometry and also the bedside arterial blood gas analysis. And I'd like to see the observation chart that includes the pulse, temperature, respiratory rate, blood pressure, oxygen saturation, and also to do the urine dipstick for the sugar, protein, RBC nitrites. And saying them means that you finished your full examination. You'll get the full marks in the examination section. And now the presentations, my dear. Now presentations, the way that I'm presenting, my dear, you need to follow them. And you need to just practice the way that I'm presenting, my dear. My clinical diagnosis of this man is pneumonectomy, as evidenced by left-sided thoracotomy scar, and also the trachea is shifted to the left side, and the chest expansion, percussion note, breath sound, and the vocal resonances are absent throughout the left side of the chest. Means that this gentleman has undergone the pneumonectomy. But I found he has got the bilateral finger clubbing, means the fingers are clubbed, along with the sputum pod at the bedside. Yes. And also I found he has got the right-sided basal coarse crepitations that don't change, that changes after coughing. So putting all them together, he has got the bronchiectasis on the right side lung and bronchiectasis that lead to the pneumonectomy. And along with that, I have found there is a left-sided phrenic nerve crush scar over the left supraclavicular space. That does mean that was treated for the old tuberculosis. So the underlying etiology of the bronchiectasis of this man is tuberculosis. So putting all them together, my clinical diagnosis of this gentleman is right-sided bronchiectasis with the left-sided pneumonectomy, and that is due to the old tuberculosis. And this bronchiectasis right at this moment is not complicated by the right heart failure, as evidenced by the absence of leg edema, and not complicated by the respiratory failure, as evidenced by the absence of the carbon dioxide retention findings at the bedside. And he is not on steroid right at this moment, as because the absence of any steroid purpura, the skin bruises are absent. So putting all them together, my clinical diagnosis of the gentleman is bronchiectasis with the left-sided pneumonectomy, and this bronchiectasis is due to the old tuberculosis and not complicated by respiratory failure, not complicated by the core pulmonary, and not on steroid. So yes, my dear doctor, listen very carefully. The presentation that you have done, my dear, you need to do practice many, many times. This case, the old tuberculosis, the phrenic nerve crush, having the bronchiectasis, sputum pod, and also the coarse crackles, the findings that he found, and the pneumonectomy and the lobectomy differentiating by the tracheal position is an integral part in this case, my dear, and you learned a lot, my dear. I hope that you enjoyed and you learned a lot altogether. Thank you very much.